One of the most common questions I receive is about low-carb snacks. I always get asked, Michelle, what are some of your favorite low-carb snacks that you would recommend? And my answer is always the same. If your goal is to reverse type 2 diabetes, no snacks is always the best option. But what if you're just getting started and it's one of those days that you're really craving something before your next meal? So you want to be prepared. And I want to talk to you about my favorite low-carb snacks and also some of the worst snacks you could have, not only on low-carb, but any type of diet. So if this is the first time you're meeting, thank you so much for being here. My name is Michelle. I'm a nurse, personal trainer, and a health coach. And I help type 2 diabetic patients reverse their type 2 diabetes naturally, get off medication safely, and the best part, be free from all the complications related to type 2 diabetes. Now let's get started. The best snack on a low carb, my number one choice, is quick, easy to make, delicious, high in protein, and really small amounts of carbohydrates. I'm talking about boiled eggs. You can make 5 or 6 at a time, put it in your fridge, and then when you have those days when you're really craving something and there's just too many hours till your next meal, you can just grab 1 or 2. Easy, right? And 2 eggs has about 1 gram of carbohydrates. Okay, so let's go to my number 2. My number 2 choice is avocado. Yes, half an avocado has about 2 grams of carbs. And it has it doesn't have that much protein, but it has a high amount of good fat that your body needs. And it keeps you satisfied for hours. And it's delicious. You don't have to cook it. You don't have to do anything. All you have to do is grab it, cut it in half, and enjoy it. Number 3, handful of nuts, like walnuts, almonds, hazelnut, macadamia, and pecan. Handful would be about 1 or 2 grams of carbohydrates, with the exception of cashews, because cashews are actually really high in carb. And I don't know about you, but when I buy cashew, it's impossible to have a handful. It's like I cannot stop eating it. I have to eat the whole package, so I never buy it. Number 4 and 5, I'm going to give you a sweeter option, because sometimes you're just craving to have something sweet. So for number 4, berries. Berries are a very good choice, like blueberries, raspberries, strawberries, or blackberries. And they're low in carb. And they satisfy that sweet craving as well. So for raspberries, 15 raspberries is about 3 grams of carbs. And my favorite, blueberries, they're delicious. About 40 of them only has about 9 grams of carbohydrates. And now for my number 5. My number 5 would be dark chocolate. But you have to make sure you're reading and is actually dark chocolate and it doesn't have any added sugar to it. So I would recommend 86% or more when it comes to dark chocolate. So a small piece, it has about 2.5 grams of carbs. And it's a great choice when you're having that sweet craving. Okay, now let's talk about some snack choices that are not recommended on a low-carb diet, especially for somebody who is trying to reverse their type 2 diabetes and get off medication. Because the goal is to have a normal blood sugar without the medication. So number 1 would be any fruit other than berries. Because remember, fruit has a lot of carbs, and when you eat it, that turns into sugar in the body. And as a type 2 diabetic, the body cannot tolerate carbohydrates. Anything other than berries is not recommended. For example, a medium-sized banana has about 24 grams of carbohydrates. Number 2, any type of fruit juices. Any coffee drinks, like your lattes, especially when you order it with oat milk. Any vitamin waters or sodas, not recommended on a low-carb diet or any type of diet because they're really not good for your health in the long run. Number 3, any type of protein bars. They're full of additives, they're processed, they're full of sugar. And if you see the ingredients, I mean, I don't know about you, but I don't understand half of the stuff that's in it. Number 4, flavored Greek yogurt. Even though it says on it is good source of calcium and protein, when you look at the ingredients, It has cane sugar, cornstarch, 5 different types of sugar, fruit and vegetable juice for color. Any Greek yogurt that's flavored, it is not recommended because it's definitely going to spike your sugar. You're better off just buying Greek yogurt and have a small amount and add your own berries. Make sure it's whole milk. And our number 5, any highly processed food like your cookies and muffin and donut and cakes, all of this is going to make your diabetes worse, it's going to spike your sugar, it's not really good for your health. Any of this, you can make it at home. There's so many amazing recipes online now, low carb and keto. And this is not only good for you and your blood sugar, but is a healthier option for the whole family. And I always tell my clients, if your food comes with commercial, then it's not real food and it's not recommended, especially if you're in a process of reversing your type 2 diabetes and healing your body. We need to be very, very cautious about what we are putting in our body. I hope today's video was helpful and useful to you. Reach out to me, let me know if you have any questions. I totally understand this might sound really restrictive and really hard to do at the beginning, but I promise you what's going to be harder is if you just take medication for your type 2 diabetes and not change any of your diet or lifestyle. And in a few years, even that medication is not going to be able to lower your blood sugar, and you're probably going to need another medication. I see this every time. It's the same patient coming back, and now that medication is not able to lower the blood sugar, and now they need to be put on another medication and another medication for the side effects of those medication. Your diabetes, meanwhile, is getting worse and worse because all medication does is treating the symptoms, which is blood sugar. We are not treating the underlying problem, which is insulin resistance and hyperinsulinemia. So I promise you, when it comes to type 2 diabetes, changing your diet, changing your lifestyle is the best thing you can do, because the choices you're gonna make now is gonna affect your health in 10, 20 years. Type 2 diabetes is a really, really scary disease. Unlike any other disease, it affects every single organ in your body. It affects your eyes, it affects your brain, it affects your heart, it affects your nerves. And I don't think we talk enough about the consequences of what happens if you don't change your diet. So this is not hard at all. If you're comparing it to, down the line, having a kidney failure, having an amputation, having blindness. If you have any questions, reach out to me. And if you're curious to see how the lifestyle you have right now is affecting your health, make sure you take my quiz. It's 10 easy questions, and I give you a personal health report and a lot of good information that is going to be helpful to you. See you next week.